Good day, great students. Today we'll be looking at clinical conditions that affect the digestive system using naturopathic treatment approach. The naturopathic approach we are actually adopting specifically for today is herbal medicine. I am Professor Gilbert Ezengige. You are welcome to Kahara Integrative Medicine Academy online class. The digestive system starts from the mouth and ends in the anus. Some of the organs of the digestive system include the tongue, the gum, teeth, esophagus, gastrointestinal, made up of the stomach, small intestine and large intestine, also called the colon. We also have liver, gallbladder, and pancreas. Everybody wants to have healthy gum and teeth, but sometimes we experience diseases that affect the gum and teeth. Two of them we just mentioned: cavities, holes in the teeth, tooth decay. Also, pyorrhea or periodontitis that affects the gum and the teeth. Most times cavities are caused by bacteria found in the buccal cavity feeding on sugary food or food particles that are lodged in between the teeth, and that can actually lead to cavities. That's why we preach good oral hygiene. There are remedies that can be utilized to treat these disease conditions. We can still revert to the use of old chew stick. A good example is Fagara root, Xanthosillum xanthosyloides. That's the scientific name. And before now, our forefathers made use of different types of chew sticks, and it helped them to a large extent. But due to modernization, most of us are only glued to the use of our various types of toothpaste and toothbrush, and we tend not to utilize good chew sticks that help to stimulate even the gums, and that can also go a long way to provide a lot of antimicrobial actions or activities to heal the gums and teeth. Now, when the gums are really infected and the teeth are getting bad, there are also remedies that can be utilized, herbal medicinal plants that can help them, like your alligator pepper, your ginger, even table salt, kaolin, that is a native chalk. There is a way it can be mixed and to form a paste, and you apply it on the affected region. You add little water to it, make it a paste to be as thick as a soft eba, because you are to apply this remedy on your gums and teeth, the affected area, of course. And because these things are all edible, you swallow them as they dissolve naturally. You are supposed to apply them about 3 or 4 times daily. And one thing you will notice is that the inflammation will begin to go down, the pain will almost begin to go down immediately. The infection load also will drop drastically. So over a few days, you are free from your gum infection or tooth ache. About the stomach and the intestine, there are many health conditions that affect them: diarrhea, abdominal pain, hemorrhoids, rectal prolapse, worm infestation, acid reflux, which is heartburn, nausea, gastrointestinal ulcers, constipation, indigestion, to mention a few. You can use some of these herbs that we're about to mention now to help support the stomach and the intestine. Basil, Ocimum gratissimum, also called Ephiri or Nchuang, can be used to treat diarrhea. It has antiseptic property. It reduces inflammation When you're having abdominal pain, it helps. When you suffer from rectal prolapse or hemorrhoids, the leaves, fresh leaves can be mashed and inserted in the anus at night, daily, to help that condition. It has antimicrobial action, fights germs, it heals wounds generally, and it also expels intestinal worms. That's what we mean by anthelmintic. And for people who have taste disorders, who cannot feel classify a particular taste, when they eat a particular thing, they will not even tell you whether it is bitter or sweet. We say they have agacia. Some have hypogacia, which means they actually can detect taste of food, but not as much as they should. Then there are people who really have the abnormal type, the dysgeusia. They will not even know and whether this one is bitter or whether it is sweet. They may even take bitter things and say, "Oh, it's salty." It's rare there, though, but then it happens. So, Basil ocimum, which is known as ocimum gratissimum, can help such conditions. Then, I've mentioned before that it can also address nausea, sore throat, stomach discomfort, and it has the ability to also remove excess gas from the system. It has anti-flatulent property. The second herb we are looking at today is aloe vera. Aloe vera expel worm. That means it's a vermifuge, useful in the treatment of gastrointestinal ulcers, best for peptic ulcer, for heartburn, for pile, for bleeding, hemorrhoid. You can also insert aloe gel, in the anus. You could soak a cotton wool, sterilize cotton wool and insert, you know, every night. It will help. It has a laxative property. It will move your bowel gently. It has antibacterial property, antiviral. It helps patients suffering from typhoid fever. It counteracts inflammation. It's a demulcent, meaning it has the ability to soothe irritated mucous membrane. Um, and it's a very powerful antibiotic. So you can actually use the gel of aloe vera. You can scoop the gel, administer up to 3 tablespoons 3 times daily, and it will do the magic. We have bitter cucumber, which is the third herb we are looking at, Citrullus colocynthis, egusibara, known to address things like constipation, worms, that means vermifuge, when you have a lot of fluid collection in the abdominal cavity. Ascites, very useful. It treats abdominal tumors and cancers. It has antibacterial property. It's a purgative and hydragogue, and that's where we have to be a little bit careful because you wouldn't want to give purgatives to a pregnant woman. You wouldn't want to give purgatives to a nursing mother either. You may not also want to give purgative loosely to children unless there are really serious cases that warrant such. It also treats colic pain and has a caminative property, meaning it can expel gas trapped within the intestinal structures. Then there are other herbs and food that can also help the stomach and the intestine. They include okra, cabbage, pawpaw, avocado, pineapple, Irish potato, cucumber, green garden egg, Cocorus olitorius, which is Ahera ewedu, tiger nut, Antoclista jalonensis is actually a tree, medicinal plant. We may have to be discussing that later. Cissus populni, the same thing. Then, of course, we've mentioned Citrullus colocynthis the last time, what we call bara. On the liver and gallbladder, there are many conditions that affect the liver and gallbladder. Let's start with the liver hepatitis, inflammation of the liver caused by a virus. Then we know there are basically five main hepatitis viruses because we have A, B, C, D, and E. And they are very, very prevalent too. Hepatitis B and C, we have 400 million cases, per annum. It's also estimated that 1.4 million people die worldwide from hepatitis every year. Statistics also reveal that 90% of hepatitis C patients can be healed within 3 to 6 months. And they are spread differently. For instance, hepatitis A and E are caused by lack of food hygiene, contaminated water, substandard sanitary facilities. Whereas hepatitis B, C, and D are actually transmitted through body fluids like blood, like sperm. So we have to note all of that. The gallbladder can be affected by gallstone. You can see the stone, you know, shown inside the gallbladder as well as in the bile duct. Gallstones, they are stone-like objects often made of cholesterol or bilirubin, can develop in the gallbladder or bile duct, and it actually, gives sufferers a lot of concern because it's a painful condition. Liver cirrhosis is also another one. In liver cirrhosis, actually what happens is that the healthy liver tissues are replaced with scar tissue. In cirrhosis, liver is permanently damaged as scar tissue keeps liver from functioning properly, and that is a serious thing. So, from normal liver, maybe due to heavy alcohol intake, liver can become cirrhotic. Scars beginning to be formed in the liver. Then, if left untreated, may even end to hepatocellular carcinoma, cancer of the liver. Let's look at plants, medicinal plants that can treat both good liver and gallbladder. Stonebreaker is the first we have to look at, Philanthus amarus. Treats biliousness, it's an antilytic, meaning it can break stones, it can shatter stones. It's an antipyretic, it lowers feverish condition, antibacterial. It's a beta tonic, it's an antioxidant. It can ward off free radicals that cause diseases. It's an antiviral remedy, very useful in the treatment of hepatitis, very useful in the treatment of malaria, very useful in the treatment of jaundice, and also very useful in the treatment of hepatopathy, disease of the liver. We can administer 1 to 2 teaspoons of this plant, the aerial part, that is the part that grows above the ground. When you get it, when you harvest it, you dry it, you can reduce it to powder. We are saying that you can administer up to 1 to 2 teaspoons. That's to adults, 2 to 3 times daily to help this condition or these conditions. Then, the second herb we are looking at is hogweed, scientifically known as Bohevia diffusa. It treats liver diseases, very useful for the treatment of gallbladder diseases. It treats gallstones, hepatitis, jaundice. It has hepatoprotective property, meaning it has the ability to protect your liver. It has hepatotonic property, meaning it has the ability to tone the liver. It stimulates emptying the gallbladder. It has been used even in India and other Asian countries for liver cirrhosis. And in Africa too, we use it for the same purpose. You can administer 1 teaspoon of root powder of this 2 times daily. It's actually the root powder that we use most often because it's the part of the plant that is most potent for this condition, liver diseases as well as gallbladder diseases. Turmeric is the third herb we are looking at in treating liver and gallbladder issues. It helps in the treatment of liver fat. It has hepatoprotective property, anti-inflammatory, antioxidant. It prevents liver fibrosis, hardening of liver tissues. It has anti-tumor property and anti-cancer property. You don't abuse the use of turmeric. It's a potent herb, so you may end up using like about half teaspoon of turmeric powder 2 or 3 times daily. But as students of Kahara Integrative Medicine Academy, we've told you before in our class, a physical class, contact class, that turmeric is known to be potentiated when you add a little of black pepper. Our own black pepper is Piper guineensis, Iyere Oziza, a pinch of it. It helps to maximize, potentiate the utilization of curcumin, which is actually an active ingredient in turmeric, so that our body can really absorb it and utilize it to address so many challenges affecting the liver. Okay? There are also other foods and herbs that help the liver. Your beetroot, your lemon, green garden egg. You also have tomato, you have date. So they are all very, very useful. You have Venonia amygdalina, which is bitter leaf. You have bitter cola, our bitter cola, which is called Garcinia cola. They are all useful. Of course, you have a plant called Kigelia africana. That's a tree. Yorubas call it pandoro. It's a very useful plant. The back of it, extract of the back of it helps to treat some liver and gallbladder diseases. So having said that, I will say keep reading. We'll continue from where we stopped today. But I know some people may be saying, oh, you've not addressed the issue of pancreas. It's also part of the digestive system. Yes, we'll discuss that in subsequent lectures when we'll be taking it alongside with the endocrine glands, because the pancreas plays double role. It functions as a digestive organ as well as an endocrine organ. So, and that's why we say pancreas is both an exocrine and an endocrine organ. When it functions as an exocrine organ, that is when we're talking about the function of pancreas as it relates its ability to secrete some digestive enzymes. And that when you are talking about pancreas as an endocrine organ, you will be looking at its usefulness when you are addressing hormonal issues, insulin, glucagon, and what have you. So I will say keep reading till the next online class. Remain blessed. Thank you. Bye.